Guys, there's no doubt that a stroke can actually change your entire world. Whether it happens to you or a family member, everything changes in that quick moment. But dealing with a stroke and living with one after is certainly something that a lot of people face, but can be handled pretty well. Ms. Hima Dalal, the founder of Vital Energy, joins us. First of all, what is a stroke? What does that mean?
Stroke, sometimes also known as a heart attack of the brain.
Okay.
Suddenly, the blood supply and the nutrients that goes to the brain cells stops. The reason can be maybe it was a massive hemorrhagic attack where the blood vessel ruptured.
Okay.
Or maybe it can be a clot, and it can be a small clot, big clot. Depending on that, the person will have a paralysis of one side of the body.
Okay.
It can be generalized weakness. It can be just a slurred speech. So there are different ways the stroke is going to give you the symptoms.
Sure. What kind of behavior? I mean, I always use the phrase, "I'm going to stroke out." I mean, can you stress that point where you actually cause that condition?
You can. If your blood pressure suddenly increases and you have been having a very poor lifestyle, a lot of stress, obesity, previous heart attacks, history of clots, and you're not paying attention, fast foods, yes, wrong food is always there, right? And the clot somehow dislodges and goes to the brain.
Okay.
Suddenly the area of the brain cells which are deprived of the oxygen and nutrients for a fraction of a moment, or it can be a long moment. But if person knows the warning signs of the stroke, which can be just a slurred speech, or maybe suddenly you feel heavy on one side of the body, or you feel tingling and numbness.
Okay, and that can happen like you're standing at work and suddenly you just
suddenly you lose it.
Okay.
And you freeze. You go in a freeze movement. If person pays attention, talks about it right away, call 911. There is a medicine, and 87% of the stroke are because of a small clots. Okay. They can be treated. They have a medicine called TPA. If that injection is given within the 4 hours of your symptoms started, you may not have that full blown paralysis. You might be able to avoid it.
If you're outside that, we have time for a quick question, Ms. Hima, but if you're outside that and you don't get that drug, what are some things you can do if you do have paralysis?
So you still need to go to the hospital. You may get admitted, you may not get admitted, you may get some medicine, but therapy is the vital. It plays a very big vital role. Okay. It doesn't matter if you have a little slur speech, you have a generalized weakness, you just have a mild coordination issue where you cannot write or you cannot button.
Sure.
You need to come to therapy, because therapists can, occupational physical therapists, speech therapists, they can help you regain your lost motion, the function, the skills, and the neuroplasty always occurs. So you can make the brain cells relaunch.
Just like that.
And it's so important. Don't stay. It doesn't matter how old your stroke is. There may be some room. Most of the time, sooner you come, faster you recover.
I love it. Miss Hima Dalal, I got to stop right there, dear. I know there's a lot we can talk about. I'll put links for you at ABC Columbia to Miss Hima Dalal, Vital Energy. Thank you for that very useful information on strokes. Guys, stay with us. We are coming back.
Thank you.